Yeah, I would just add that this whole concept of the effect that aging has on the family is just profound. The Senate Select Committee on Aging made the observation a few years ago that the average American woman can expect to provide care for a child for 17 years and care for an elderly parent for 18 years. And that's just the nature of what we're seeing in the country. Part of what would help is if we could get younger people to think about aging earlier and to plan for their long-term care needs. And this is something that just doesn't happen. We're in denial. You can't sell long-term care insurance in this country because people wait until they need it to buy it, and it's unaffordable. But there is a bill now, the CLASS Act, that is part of the consideration around health reform that would provide a cash payment to individuals who need long-term care. It would give $50 or $100 a day that you could direct then as a consumer to buy what you feel you need for your long-term care services. And that would be funded by an optional payroll system. So you could opt out of this, but everybody would be paying about $30 a month to get a $50 a day or $100 a day benefit. Medicare Part B is an optional program, but people stay in it. So if we can do more to get people to not be in denial of aging and to plan for it, so we get away from this Medicaid pay-as-you-go welfare system of long-term care, where there is no trust fund for Medicaid. It's the primary payer for long-term care, but we have to find that money every year. If we'd funded in advance through a program like this, we would have people thinking about long-term care and that connection, I think, earlier.